Welcome, I'm Dr. Melina Roberts, and I want to talk about how a normal TSH reading in your blood work does not necessarily mean that you have a thyroid that is functioning properly. Now, there's a number of different aspects that can go into this, but I just want to go through one of the scenarios that I see quite commonly in my practice. So the one common way that I see is that patients will come in and they will have that diagnosis of hypothyroidism, so an under-functioning thyroid. They will bring their recent blood work into me, and that recent blood work will show a TSH, which is within normal range. In a lot of cases, the only thyroid hormone that has been tested in the blood work is just the TSH, which, first of all, letting you know that that is an incomplete picture of what's going on in terms of the thyroid. And they will still be experiencing symptoms of a low functioning thyroid, like cold hands and cold feet and hair loss and difficulty losing weight and a slower metabolism and constipation. And they will be told that their blood work is normal, so everything is fine, so their thyroid is functioning well. And I want to go through why this may be an inaccurate description of what's going on. Because, first of all, the one question I will ask is, were you on medication like Synthroid, so synthetic T4? Were you on a medication when this blood work was done? And in most cases, people are saying, yes, I was taking the medication while I was on, while I went and got this blood work done. And then I was told that my numbers are now within normal range, and so everything is fine. Now, what you need to realize is that TSH, so the thyroid stimulating hormone, is evaluating how much T4 we have in circulation. Now, if you are taking synthetic T4 in a medication, then you are putting a lot of T4 into circulation, and then the TSH will shift into a normal range. But what you've done is you have biochemically manipulated the blood numbers, but you have not necessarily turned this thyroid on and got that thyroid to actually function properly. Because the next step that the body has to do is the body then has to convert inactive T4 into active T3. And if your body's not able to do that conversion, then we can't actually get that thyroid to function properly. So there's a number of different factors that go into the thyroid, and just putting someone onto Synthroid doesn't necessarily resolve the thyroid problems. And there's a number of different factors that go into this, and I go through this in a lot more detail in one of my courses called Balance the Thyroid. And if you are interested in learning more about the thyroid and how to balance the thyroid and really all the different aspects that can go into effectively allowing that thyroid to function better, then this course is for you. I will put the links to that course in the notes below, and I hope that you, if this is something that is affecting you that you will sign up for this course and learn more about how you can effectively help your thyroid to function better. All right, so thank you so much for listening. I encourage you to share this with your friends and family, to press the like button, to make a comment below, and until next time, continue to learn, grow, and build health.